Hello everyone, my name's Katie L's Gamer and welcome to SurgerySquad.com. I used to love these type of games when I was younger. I still do. And with my mum being a neuro nurse and everything, I grew up with knowing this kind of thing. Like I've seen them in books and TV programs, that kind of thing, and I've never been squeamish when it comes to surgery or anything medical. And the first one I'm going to do is tattoo removal. I don't have any tattoos, I don't plan on getting anytime soon, but I am curious to see how they're removed. So let's get started.
Welcome to Surgery Squad's laser tattoo removal.
Hi.
I'm Dr. Susie and I'll be assisting you with this procedure today.
Assisting me? Okay.
According to a recent poll, over 50% of those with tattoos want at least one removed.
I wonder why.
They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them.
Okay.
Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after...
I wonder what that says. That's a classic. I think when you get something meaningful in a Chinese symbol, but you end up with something completely different and probably inappropriate.
multiple treatments. Those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade. Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager.
Of course.
Now that he's older, he doesn't see the tattoo as being so attractive anymore.
Right. Well, yeah, as far as I know, you have to be 16 or 17 to get a tattoo. I don't know because I'm not interested in getting one. So, he's probably about a little older than me and he's made a stupid decision. Classic. I'm really curious to see what his tattoo looks like.
In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him. Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner.
Yeah, more than one.
Use the arrows to scroll through the tattoos. Click choose when you have made up your mind.
Okay, I think that's a gambling reference. So, that's on the list. Ew. Okay. Spring break. Not so bad. That one's kind of cool. This is all done by a scratcher. Ew, that one definitely was. Wait a minute. He's in his mid-20s and he got it done when he was a teenager. That Beth better be your sister, mate. I didn't give you a name. Well, she didn't give you a name. Mike. Your name's Mike. Mike, you better have a little sister called Beth. And I really hope she doesn't look like that. Anyway. There's something you're not telling us, Mike? I'll have to. Well, I think it has to be Princess Beth. Yikes. I think that was done by a scratcher. Really? Really?
Yikes! She doesn't really look like that, does she? Let's make that tattoo disappear.
Yeah.
During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started. A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time.
Oh, they know that.
So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Have you ever had 100 rubber bands twanging your skin at the same time? Does that be impressive? Painful, but impressive. Alright, cover that lovely face. Ugh. Jeff's Instant Chill Pack.
That will do. Now we need to use the laser to fade the tattoo.
Okay.
Different types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result.
Oh.
To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Okay. I think not Jeff, that's the guy who owns the ice pack. Mike, our patient, I think he's a good example that if you ever want a tattoo, make sure you're going to like it in, I don't know, 30 years. Anyway, she said red, so get rid of this. Princess Beth. You're definitely something, but ain't a princess, I tell you that. Okay, we've done that. What's next, Susie?
Next up is green, blue, or other darker colors.
Okay, does that include the black? Black's a dark colour. Yeah. When I was a teenager, I was obsessed with temporary tattoos. But I never thought about getting a real one, because I know I'd probably end up hating it, like Mike. Okay, the black's not fading, so must be another laser.
Finally, we'll remove the black.
Okay, great. Mike, make better life choices. And I hope Beth really is your sister, because you got some explaining to do. Well, not really, but, you know, it doesn't give a good impression. We'll just assume Beth's your sister.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area to relieve some of the pain.
Okay. Instant chill.
You did great! Our patient is ready to go.
Thank you.
Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
I can do that. The tattoo's already improved.
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments, so he shouldn't expect the tattoo to go away during one session. While the tattoo may not be completely removed, it should be lighter and much less visible than before.
I know another way. Okay, the next one I can relate to greatly because I've recently had my wisdom teeth taken out. My bottom right one and my top left one. And the consultant was even cool enough to let me keep them as well. In fact, be right back. See? I was fine throughout the whole procedure, and they do look cool. I don't know if you can see them there because they're lighting, but they really did need to come out. And my first dentist wasn't very good. I kept telling them that I'm in pain, they hurt, and they're like, "Oh, just keep them clean, they'll be fine." Yep. A couple of months later, got a new dentist. They said they need to come out, and so they're out. And my pain's gone, and I can actually feel the stitches still here. And I've had to eat chicken soup for 2 days.
Welcome
Who
to
are you?
Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure
You're the
today.
guy who owns the ice pack.
A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars,
2 in my
commonly
case.
known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems.
Tell my old dentist that. Always keep your teeth clean, kids.
Our patient today is having their lower right wisdom tooth removed, or
Just like me. give you a name. You're going to be called Daisy. Anyway.
As a dental professional may refer to it as tooth number 32.
Yeah, 32.
Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth.
Okay. I've had this done many
Next,
times.
position the
before.
X-ray cylinder where indicated.
When I went down for my assessment, the X-ray machine looked nothing like that. I had to stand up, bite down on this metal thing, while this machine went right round my head. Yeah, it was so cool. It was like a sci-fi movie.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to.
Watching 20 hours of television would expose you to more radiation than one dental X-ray. You mean 20 hours in a row? Otherwise, how do you know that? Okay.
And take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure.
What about us?
I couldn't have done it better myself.
I didn't do anything.
I'll have my assistant finish up the rest of the x-rays.
Okay, you do
and
that.
then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots. And now that all of the x-rays have been completed,
Better than
we
mine
can
did.
extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have 2 or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction.
I didn't have that
Our
done.
patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic.
So did I.
To begin, you'll need to apply a topical numbing gel to the anesthetic injection site.
I didn't have
This
that
will
done.
help decrease any pain the needle may cause.
I didn't have that done. I didn't need it, but I didn't have it done.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
Hey, that was nothing to me. Not to brag. Come on, Daisy, you didn't hurt that much.
And now we'll give our patient a few minutes to become completely numb.
Contrary to popular belief, most dentists today use lidocaine? Lidocaine? Is that right? Anyway, not Novocaine for local anesthetic. Local anesthesia, sorry. Okay. I did not know that. Interesting.
Great. The patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
So that's what was happening inside my mouth.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
This is the same tooth I had taken out, and the dentist had to actually cut into my gum so he can get a better grip on it, which is normal for some people. But this one came out no bother. I'm quite glad of that, because I can feel the stitches when I roll my tongue around that area. Which one? Note. Okay. Yep, just like that.
Now clean the area using a surgical suction. This will allow us to check the area for any bony matter or tooth structure that may be left in the socket.
That's what my dentist said. Hey, I was totally fine during the procedure. Like, the only thing I was wondering about was, what the hell's going on inside my mouth? Okay, Daisy. Daisy won't be feeling any of this. I know, because I didn't, and I was numb on both sides. It was kind of funny. I couldn't feel anything at all.
Everything looks great, but we're not done yet.
The gauze.
Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
Luckily she doesn't need stitches either, like me. Are you clotting?
Since the patient is clotting properly,
Great.
we can go ahead and place some fresh gauze in their mouth.
And do
When
anything.
getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity.
Or if you have stitches in your gum like me.
Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days,
Nope.
avoiding sodas and the use of a straw,
Straw, yes.
and gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours.
I was told just to use painkillers, but that helps as well. Keeps it clean.
It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area.
Good if I don't smoke then.
And that's a wisdom tooth extraction. You did great. If you're up to it, why not try another procedure on surgerysquad.com?
Well, that was interesting. Now I know what was going on inside my mouth. Well, I did know, but I couldn't see what was going on. And he talked me through it the entire time, which was good of him. Okay, next one is silicone breast implants. I've got a feeling I may have to censor some of this. Let's learn though. Susie!
Welcome to Surgery Squad's virtual breast enhancement surgery with silicone gel implants. I'm Dr. Susie, and I'll be assisting you with this procedure today. For those with a weak stomach or have children in the room, I need to let you know that the next few steps get a bit graphic and contain nudity.
Yep, I'm going to censor some of
This
it.
procedure may not be appropriate for work or school environments. Click the continue button when ready.
You heard her. If you're squeamish, go on. And again, if you made it this far into the video, good on ya. Okay, yep, I'm gonna have to censor a lot of this. I knew.
Breast enhancement surgery, also known as augmentation mammoplasty, involves increasing the size or changing the shape of a woman's breasts.
She looks happy.
Through the placement of silicone implants under the breast tissue or under the chest muscle behind the breast. The surgery can give a woman fuller breasts or restore breast volume lost after weight reduction or pregnancy. It is also done to equalize breasts that are different sizes or as a reconstruction after breast surgery, such as a mastectomy.
Aww.
Our patient has recently lost weight and feels that her breasts are now too small. She has chosen to augment them through surgery. She has spent time with her doctors to understand what is involved in the surgery, as well as the benefits and risks. Her surgeon offered a computer program that simulates what the patient would look like with different breast sizes. Use the slider to demonstrate to our patient what she would look like with different sized breasts.
Yeah. I feel stupid now because I just thought they put it in like right inside the breast, not underneath the breast tissue. Oh. Ew. Alright, let's see.
It looks like our patient has chosen a size she likes.
Ah.
Let's put on our gloves and see what we can do.
You didn't say what size she
In
wanted
order
though.
to make sure each implant is in the correct
Not that it
position,
matters.
we must first mark the current top of the breast and where the midline between the two breasts is as well.
Right.
This will help us when we position the implant. I've marked each of these with a dotted line. Can you draw them in with the marker?
I think so. I probably won't go down like... Yeah, that was nowhere near the line. I don't think it'll matter. It's not that kind of game that makes you do it spot on perfect. Yeah. Patient needs a name. Clara. Clara? They're a little lopsided. The viewers won't be able to see it, but they are. Oh well. You got the right surgery anyway. Well, right surgeon? Maybe not. I'm probably a lot younger than you. Can I draw anything else on you? Let's draw a little heart. Little heart from Katie.
We need to
Where'd my
measure
heart
the
go?
breast to decide where the top of the implant should go. We do this by measuring with the caliper from the middle of the areola. Draw with the marker at 12 centimeters to mark the top of the implant, and then draw the outline of where the implants are going to be placed.
Alright. You won't be able to see this because of the censoring.
Now that
I didn't
we've
even
marked the
do
patient,
anything!
let's get her to the operating room.
I just pressed continue.
To begin the surgery, we need to start an IV to provide our patient with fluids and medication. I've already tied a tourniquet around her upper arm. Can you find a suitable vein in the patient's hand?
Yes, I can, but I'm more interested with that wedding ring tan mark. It is a left hand, I can tell. Of course, they will have to take out all any jewellery during a surgery, but that's not very interesting. Did you leave your husband, Clara? Don't worry, you can tell me. It's okay. I'm with you. You're gonna make him sorry. You're gonna look beautiful. Beautifuler, not you weren't beautiful before. But you're gonna make him cry himself to sleep every night.
That'll work. Sterilize the insertion area using an alcohol wipe.
Okay, I can do that. Done.
Insert the needle and advance the angiocatheter into the vein.
I know how this works. Seen it done many times before.
The small burst of blood
Even
that
I've had
just
it done.
appeared in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
Yep.
Once you remove the needle, it will be properly disposed in a sharps container.
Because there.
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. Lastly, we need to secure the IV with tape and test the line.
I could have done that.
Next, we'll use a chemical antiseptic known as chlorhexidine to cleanse the patient's skin. Use the applicator to apply the chlorhexidine to the surgical site.
Isn't that what they use in mouthwash? Oh well, good job I'm not a surgeon then. Or a doctor, or a nurse. Alright Clara. We're gonna make you feel good. When you look good. Okay, I'm done. Done.
While some anesthesiologists may prefer to give a patient a general anesthetic using the IV line, we'll be administering it using a face mask. Once the patient begins breathing in the anesthetic gas, her bloodstream will absorb the gas and carry it to her brain. At this point, her brain will stop receiving signals from the nerves in her body, allowing her to be completely asleep and pain-free during the surgery.
Yep.
Start by placing the mask over the patient's nose and mouth.
Okay.
Once it's in place, we'll turn on the anesthetic gas.
Okay, Clara. Go to sleep and good night. Da 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 da. When you wake up, you'll feel like a new woman.
Now that our patient is unconscious, we'll insert an endotracheal tube into her mouth and down into the windpipe. This will help her breathe and provide a constant mixture of oxygen and anesthetic gases during surgery.
Also, when she's unconscious, it won't interrupt the gag reflex. Must be a horrible feeling though.
The incisions for breast enhancement surgery may be made under the breasts, around the areolas, or under the arm.
That's why I
For this
thought
procedure,
so.
we'll make the incision under the crease of each breast. This area leaves little noticeable scarring. Now sketch where we'll be making our
Also,
incisions.
it's almost like less likely to tear as well, because I don't see how that would work, having it like underneath the, well, not underneath, but by the armpits. Ugh, the thought of it tearing, ooh, it must be painful. Yikes. Anyway, okay. Target incision done. Nowhere on the line, but oh well.
Let's use the scalpel and make the necessary incisions so we can insert the implants. Our patient has chosen silicone gel-filled implants because they have a more natural feel. We'll have to make a slightly longer incision in order to insert the implants. This is due to the implants being full when inserted, as opposed to saline implants, which can be inserted empty.
Hey, you just stabbed her. Right, okay. Whatever you say, Susie. Okay, done.
With our incisions made, we'll now make room for the implant. To do so, we need to slide a finger into the incision and gently sweep it back and forth to separate the pectoral muscle from the ribs. Using a finger is gentler than a metal instrument and lessens the chance for damage to the nipple's nerves.
That must be
Can
really
you
weird.
slide your finger into the incision and move it back and forth to create the pocket for the implant?
Yes, I can. It's really weird though. Ugh, squishy. Squishy. Okay. You won't be able to say this, but the nipple's like moving everywhere. Looks funny.
Now we carefully insert a retractor and cauterize any muscle groups still attached.
Good Clara, how much weight did you lose? I can see your ribs. Oh well. Up it goes then. Was. Okay. Fine. I love how it comes out clean. Sounds like bubble wrap popping.
Nice job! Now we need to prepare the implants.
Okay.
Breast enlargement is achieved through the placement of a silicone pouch called a lumen. The lumen may be filled with either silicone gel or saline. There are advantages and disadvantages to each type. Click each implant type to see the pros and cons of each.
Okay, so Clara's getting silicone, so we'll learn about that first. Pros of silicone gel breast implants: maintains a firm shape, resistance to rippling or collapsing, similarity in feel to natural breast tissue. Okay, I wouldn't know, but okay. Cons of saline breast implant: potential silent ruptures. That doesn't sound good. Silicone related health risks: can inhibit mammograms and breast exams. Well, as long as the person given the mammogram knows you've had implants, then there should be no problem. Hopefully. Now, for the other one, saline. Pros of saline breast implant: low safety hazard with leaks, immediate detectability of a rupture saline implant. Well, we want to avoid that at all costs. Lower cost, of course. Increasing or decreasing the size of existing saline breast implants is fairly simple. Good. Create less noticeable scarring since require smaller incisions. Right, well, scars can heal pretty good if they're done right. So that wouldn't bother me if I had it done. Cons: less natural feeling, weight and texture. That's a con. Tend to collapse or distort when laid flat or in other positions. That sounds like the biggest con of all. Especially because when I fall asleep on my front and I wake up on my back. And I don't even want to go there. Yikes. Okay, so done.
As I said, our patient has chosen the silicone gel implants.
I think I would
Unlike
as well.
saline implants, silicone implants come pre-filled and ready to go. All we need to do is open the sterile pack and insert the implants into our patient.
Dr. Jeff,
With our
the dentist.
incisions made, we now need to slip the implants into the pockets we created under the chest muscle. We do this with our hands.
All right.
Because the lumen is fully filled, it can be a little tricky to get the implant in place. As you tuck in one side, another will slide out. Can you use your finger to slide the implant into place?
I think so. This is so weird.
Now we adjust the implant with our finger.
How? Oh, like that. I didn't do anything.
Great. Let's do the other breast and then we'll check them for evenness.
Well, it was nothing like I expected.
Our patient is still under anesthesia,
Right,
but we've placed her in an upright seated position.
won't it fall out?
This is so we can inspect the breast for implant placement and evenness. We examine the top and bottom of the implants in the breast as well as the placement of the nipples. It looks like the left implant
Yeah, I
is
was
a
gonna
little
say.
higher than the right. Can you lower it?
I was going to say, it did look a little lopsided. Not like you'd be able to see it. Yeah, we can do that. And how? Ah,
Perfect.
okay.
Now we need to move our patient back to a flat position to prepare to close the incisions. With our patient lying down again, we'll inject some long-lasting numbing medicine into the incisions before closing. And we're ready to close.
Okay. I can do that. Oh. Look, no hands. That is oddly satisfying. I like good stitches. Telekinesis.
Excellent work. Breast enhancement is typically an outpatient procedure. The patient is released once she has recovered from the anesthetic. The patient is sent home wearing a support or sports bra. Her surgeon will offer additional advices as to when to wear this during recovery. Removable stitches are taken out after about a week. Dissolvable stitches typically disappear in about 6 weeks. When our patient returns home, she needs to ensure that she's following our doctor's recovery guidelines. Be aware that if the implant is placed under the chest muscle, limited activity will last longer.
Yeah, so you get adequate rest, take pain medication as directed, take sponge baths until sutures are removed. That would suck. No heavy lifting or arm or chest exercise for around a month afterwards. Right. Also, invest in new bras, because bras are expensive. Especially ones that aren't beige. Anyway.
And there we have breast enhancement surgery using silicone implants. After a patient's recovery, she is happier about her appearance and is more confident in herself.
Good for her.
Thanks for stopping by Surgery Squad. Why not check out one of our other great surgeries?
Well, that was really interesting, and I had no idea it was that simple. Not that I want to be a surgeon or a doctor or anything. Anyway, I'm going to leave it here. If you liked it, hit that like button, and don't forget to subscribe for more. See you soon!